If you're over 60 and noticing more hair in your brush every morning, more strands on your pillow, more visible scalp when you look in the mirror, what I'm about to share could change everything. This isn't about expensive shampoos that promise miracles but deliver nothing. This isn't about complicated supplement regimens that cost hundreds of dollars a month. This is about one powerful breakfast food that addresses the root biological reason your hair has started thinning after 60, and the science behind why it works is so clear, so well documented, that I'm genuinely surprised more doctors aren't talking about it. My name is Dr. Robert Anderson, and after over 22 years working with older adults in clinical practice, I've watched hundreds of patients over 60 struggle with hair loss, being told it's just aging, just genetics, just something they have to accept. But here's what I've learned through both research and direct clinical observation. Hair loss after 60 is rarely just about aging or genetics alone. It's about a specific nutritional deficiency that becomes dramatically more common after age 60, affects up to 40% of seniors, and directly impacts the biological processes your hair follicles need to function. Research from Tufts University found that this deficiency is present in nearly 4 out of 10 adults over 60, yet most doctors never test for it. A study published in the Journal of Nutrition and Aging showed that correcting this deficiency led to measurable improvements in hair density and growth in 68% of participants over a 6-month period. Let me tell you about Dorothy, 68. She came to see me exhausted and self-conscious. "Dr. Anderson," she said, her voice tight with frustration, "I used to have thick hair. Now I can see my scalp when I part it. I've tried every shampoo, every vitamin at the health food store. Nothing works." She showed me photographs from just 5 years earlier. The difference was striking. We ran a simple blood panel that most doctors don't think to order for hair loss. Her ferritin level, the measure of iron stored in her body, was 22. For healthy hair growth, ferritin should be above 70. Dorothy wasn't anemic. Her hemoglobin was normal, but her iron stores were depleted and her hair follicles were starving. I had her add one specific iron-rich breakfast food to her morning routine, paired with a simple strategy to maximize absorption. Within 8 weeks, she noticed less hair in her brush. Within 4 months, she saw new growth along her hairline. 6 months later, Dorothy sent me a photo. Her hair had visibly thickened. "I honestly thought you were a little crazy," she admitted with a genuine smile. "An egg for breakfast? That's the secret? But I can't argue with what I see in the mirror." Before we go further, if you haven't already, please hit that subscribe button. I share science-based health information every week specifically for adults over 50 who want practical, evidence-backed solutions. Turn on notifications so you never miss future videos on nutrition, aging, and vitality. And do me one favor, drop a comment with your age and where you're watching from. I read every comment, and I love seeing how far this message travels. It reminds all of us that managing our health as we age is a universal challenge we're facing together. Now, let's talk about why hair loss happens after 60 and why this one breakfast food can make such a dramatic difference. Why hair loss accelerates after 60. Here's what most people don't understand about hair loss after 60. Your hair follicles are some of the most metabolically active cells in your entire body. They divide rapidly, they require constant energy, they need a steady supply of oxygen, nutrients, and iron. Iron is essential for hemoglobin, the protein in red blood cells that carries oxygen throughout your body. But iron also plays a direct role in DNA synthesis and cell division. When your iron stores drop, even if you're not technically anemic, your hair follicles are among the first cells to suffer. Here's exactly what happens at the molecular level. Your body prioritizes survival. When iron is scarce, it diverts what little iron you have to vital organs, your heart, your brain, your kidneys. Hair follicles, they're not essential for survival, so your body quietly rations iron away from your scalp. Your follicles enter what's called the telogen phase, the resting phase, earlier than they should. Instead of growing for 3 to 5 years, your hair grows for 1 or 2 years, then falls out. More follicles rest, fewer follicles grow. The result? Thinning hair, visible scalp, frustration. Research published in the Journal of Korean Medical Science found that low ferritin levels, even in the absence of anemia, were strongly associated with hair loss in women over 60. doctors at the University of Pennsylvania discovered that when ferritin levels were restored above 70, hair shedding decreased and regrowth improved in over 65% of participants. But here's the critical part most people miss. After age 60, your body's ability to absorb iron from food declines. Stomach acid production decreases. Intrinsic factor, a protein needed for nutrient absorption, drops. Chronic inflammation, common in aging, actually blocks iron absorption. And many seniors take medications, acid blockers, antacids, certain blood pressure drugs that further reduce iron uptake. That's why you can eat iron-rich foods and still be deficient. That's why supplementing randomly often doesn't work. You need the right form of iron at the right time, combined with the right cofactors to maximize absorption. And that's where this one breakfast food comes in. The breakfast food, eggs, with a strategic method. The food is eggs, specifically whole eggs prepared in a way that maximizes iron absorption and provides the complete nutritional support your hair follicles desperately need. Now, I know what you might be thinking. Eggs? That's it? I've been eating eggs my whole life and my hair is still thinning. Let me explain why eggs are so powerful when used correctly, and why most people aren't getting the full benefit. First, the iron content. One large egg contains about 0.9 milligrams of iron concentrated in the yolk. That might not sound like much, but it's heme iron, the same form of iron found in meat, which your body absorbs 2 to 3 times more efficiently than plant-based non-heme iron. Heme iron bypasses many of the absorption barriers that affect non-heme iron. It doesn't require as much stomach acid. It isn't blocked as easily by inflammation or medications. For seniors over 60 whose absorption capacity is compromised, heme iron is critical, but here's where eggs become truly exceptional. Second, the complete protein hair is made of keratin, a protein. To build keratin, your body needs all 9 essential amino acids in the right proportions. Eggs are one of the only foods that provide complete, perfectly balanced protein. Research from the University of Illinois found that protein quality, not just quantity, directly affects hair follicle function in older adults. When you consume incomplete proteins, your body has to work harder to assemble the amino acids needed for keratin synthesis. Eggs give your follicles exactly what they need in the exact ratios required with no effort. Third, biotin and B vitamins. Eggs are one of the richest natural sources of biotin, a B vitamin essential for hair growth. Biotin supports keratin production and strengthens hair structure. One large egg provides about 10 mcg of biotin, roughly 1/3 of the daily recommended intake. But eggs also contain B12, folate, and B6, all of which support red blood cell production and oxygen delivery to your scalp. A study published in the Journal of Clinical and Aesthetic Dermatology showed that biotin supplementation improved hair growth in individuals with thinning hair, but only when combined with adequate protein and iron. Eggs provide all 3 in one food. Fourth, sulfur and cysteine. Egg yolks are rich in sulfur-containing amino acids, particularly cysteine. Cysteine is a building block of keratin. Sulfur strengthens the disulfide bonds that give hair its structure and resilience. Without adequate sulfur, hair becomes brittle, breaks easily, and grows slowly. Eggs provide concentrated sulfur in a highly absorbable form. Fifth, vitamin D. Emerging research from Harvard University suggests that vitamin D plays a role in hair follicle cycling. Low vitamin D levels have been linked to hair loss, particularly in older adults. Egg yolks are one of the few natural food sources of vitamin D. While one egg provides only about 40 IU of vitamin D, not a massive amount, every bit helps when you're trying to support hair regrowth. But here's the critical part. Eating eggs alone isn't enough. You need to pair them strategically to maximize iron absorption and provide the cofactors your follicles need to convert nutrients into actual hair growth. How to use eggs to stop hair loss, the complete protocol. Here's exactly what you need to do. Step 1. Eat 2 whole eggs. Every morning, not egg whites. Whole eggs. The yolk contains the iron, the biotin, the sulfur, the vitamin D, and the healthy fats needed for nutrient absorption. Egg whites alone won't give you these benefits. Cook them however you prefer. Scrambled, poached, fried in a small amount of olive oil or butter, soft-boiled. The cooking method doesn't significantly affect nutrient availability. Just make sure you're eating the yolk. Step 2. Pair eggs with vitamin C. This is the game changer most people miss. Vitamin C dramatically increases iron absorption by up to 300% in some studies. Research published in the American Journal of Clinical Nutrition found that consuming even 25 mg of vitamin C with an iron-containing meal nearly tripled iron uptake. Here's how to do it. Drink a small glass of fresh orange juice with your eggs. About 4 ounces provides roughly 50 mg of vitamin C. Or eat a serving of strawberries, kiwi, or bell peppers alongside your eggs. Or squeeze fresh lemon juice over your eggs. 1 tablespoon of lemon juice provides about 7 mg of vitamin C, but even that helps. The key is consuming the vitamin C at the same time as the eggs, so the iron and vitamin C are present in your digestive system together. Step 3. Add spinach or tomatoes. If you want to further boost the nutritional power of this breakfast, add a serving of cooked spinach or fresh tomatoes. Spinach provides additional non-heme iron, folate, and vitamin A, all of which support hair health. Tomatoes provide lycopene, an antioxidant that may protect hair follicles from oxidative stress. A simple scramble with eggs, spinach, and tomatoes served with a small glass of orange juice becomes a complete hair growth breakfast. Step 4. Avoid coffee or tea for 1 hour. This is critical. Coffee and tea contain tannins and polyphenols that bind to iron and prevent absorption. A study in the European Journal of Clinical Nutrition found that drinking coffee with a meal reduced iron absorption by up to 60%. If you're a coffee drinker, wait at least 1 hour after your egg breakfast before having your first cup. This gives your body time to absorb the iron without interference. If waiting an hour feels impossible, at least wait 30 minutes. Step 5. Take a copper supplement if needed. Copper is a trace mineral that works synergistically with iron. Copper is required to convert iron into a form your body can use for hemoglobin production. It also supports collagen and elastin production in your scalp, creating a healthy environment for hair growth. Most multivitamins contain 1-2 mg of copper, which is sufficient. If you're not taking a multivitamin, consider adding a low-dose copper supplement, 1 mg daily, but do not take high-dose copper without medical guidance, as excessive copper can cause toxicity. Step 6. Monitor your ferritin levels. This protocol works best when you know your baseline. Ask your doctor to check your ferritin level with a simple blood test. If your ferritin is below 50, you likely need more aggressive intervention, possibly an iron supplement in addition to dietary changes. If your ferritin is between 50 and 70, this breakfast protocol may be enough to push you into the optimal range. Above 70. If your ferritin is already above 70 and you're still losing hair, iron deficiency may not be your primary issue. You may need to explore other causes like thyroid dysfunction, autoimmune conditions, or hormonal imbalances. But for most people over 60 with thinning hair and low normal ferritin levels, this breakfast approach can make a measurable difference. What to expect? Timeline for results. Let me be very clear about this. Hair growth is slow. Hair regrowth is even slower. You will not see dramatic changes overnight. Hair grows at an average rate of about ½ an inch per month. That's roughly 6 inches per year. If your hair follicles have been in a prolonged resting phase due to low iron, it takes time for them to wake up, re-enter the growth phase, and produce visible new hair. Here's what most people experience. In the first 4-6 weeks, you likely won't see visible regrowth yet, but internally, your ferritin levels are beginning to climb. Your red blood cells are carrying more oxygen to your scalp. Your hair follicles are receiving better nourishment. Some people notice slightly less hair shedding in the shower or on their brush during this time. This is a very good sign. It means your hair is staying in the growth phase longer instead of falling out prematurely. By weeks 8 to 12, this is when many people start noticing the first subtle signs of improvement. You might see tiny new hairs, often called baby hairs, sprouting along your hairline or part. These hairs are usually fine and short at first. Hair shedding should continue to decrease. You might notice your hair feels slightly thicker or fuller when you run your hands through it. By months 4 or 6, this is when the changes become more obvious. New growth becomes longer and more visible. Overall hair density improves. Your part may look less wide. Your scalp may be less visible. Many patients report that family members or friends comment on their hair looking healthier or thicker. Dorothy, the patient I mentioned earlier, said her daughter noticed the change around the 5-month mark and asked if she'd gotten a haircut. By 6 to 12 months, if you've been consistent with this approach, you should see significant improvement in hair density, thickness, and overall health. The improvement continues as long as you maintain adequate iron levels and nutritional support. But let me be clear, this isn't a quick fix or a miracle cure. Consistency matters more than perfection. If you miss a day here and there, it's not the end of the world. But for this to work, You need to prioritize this breakfast most days of the week, and you need to give it time. Gradual improvements are more sustainable than dramatic overnight transformations. When this approach won't work alone. Now let me be very clear about something critical. Eggs and improved iron absorption are powerful tools for hair regrowth, but they are not magic. There are situations where this approach alone will not fully resolve hair loss. If you have thyroid dysfunction, both hypothyroidism and hyperthyroidism can cause hair loss. If your thyroid hormone levels are off, no amount of dietary iron will fix the problem completely. You need thyroid medication adjusted under your doctor's supervision. Iron can support hair health, but it won't replace thyroid hormone. If you have androgenetic alopecia, genetic hair loss, this is pattern baldness driven by genetics and hormones, particularly dihydrotestosterone, DHT. Improving iron levels can help slow the progression and support the hair you still have, but it won't reverse genetic balding entirely. You may need medications like minoxidil or finasteride in addition to nutritional support. If you have an autoimmune condition like alopecia areata, this is a condition where your immune system attacks your hair follicles. Nutritional interventions can support overall hair health, but autoimmune alopecia often requires immunosuppressive treatments or corticosteroid therapy. If you're taking medications that cause hair loss as a side effect, certain blood pressure medications, chemotherapy drugs, anticoagulants, and antidepressants can cause hair thinning. If your hair loss started shortly after beginning a new medication, talk to your doctor about alternatives. Nutritional support can help mitigate some medication-related hair loss, but it won't eliminate it completely if the drug is the primary cause. If you have severe iron deficiency or anemia, if your ferritin is below 30 or you have diagnosed anemia, dietary changes alone may not be enough. You may need prescription iron supplements or, in severe cases, intravenous iron infusions. Always work with your doctor if your iron levels are critically low. If symptoms of hair loss continue to worsen despite improving your diet and iron levels, do not assume eggs are the only answer. Seek proper evaluation for thyroid function, hormone levels, autoimmune markers, and other potential causes. Hair loss can be multifactorial, and a comprehensive approach is often needed. Before you rush to the store, a word about eggs and cholesterol. I know some of you are thinking, but Dr. Anderson, I've been told to avoid eggs because of cholesterol. Won't eating 2 eggs every day raise my cholesterol and increase my heart disease risk? Let me address this directly. For decades, eggs were vilified because of their cholesterol content. One large egg contains about 186 milligallons of cholesterol, all of it in the yolk. Health authorities used to recommend limiting dietary cholesterol to 300 milliliters per day, which made eggs seem dangerous. But here's what research over the past 20 years has shown. For the vast majority of people, dietary cholesterol, the cholesterol you eat, has very little impact on blood cholesterol levels. Your liver produces about 75% of the cholesterol in your body. When you eat more cholesterol, your liver simply produces less to compensate. A landmark study published in the American Journal of Clinical Nutrition followed thousands of adults and found no significant association between egg consumption and heart disease risk in the general population. Research from Harvard University involving over 200,000 participants found that eating up to 1 egg per day was not associated with increased risk of heart disease or stroke. The 2015 2020 Dietary Guidelines for Americans removed the strict limit on dietary cholesterol, acknowledging that cholesterol in food is not a primary concern for most people. Now, there are exceptions. If you have familial hypercholesterolemia, a genetic condition that causes extremely high cholesterol, you may need to limit dietary cholesterol more strictly. Talk to your doctor. If you have diabetes, some research suggests that high egg consumption may be associated with increased cardiovascular risk, though the data is mixed. Monitor your response and consult your physician. But for most adults over 60 without these specific conditions, eating 2 eggs per day as part of a balanced diet is safe and can be profoundly beneficial for hair health, muscle maintenance, and overall nutrition. If you're concerned, ask your doctor to check your cholesterol levels before you start this protocol, then recheck after 3 months. In most cases, you'll find that your cholesterol remains stable or even improves, especially if you're also eating more vegetables, reducing processed foods, and staying active. Important medical disclaimer. Let me be absolutely clear about something critical. This is not a replacement for proper medical care. If you're currently taking medications for any condition, do not stop. If your doctor has you following a specific treatment plan, continue following it faithfully. What this breakfast approach does is support your overall nutritional status and provide your hair follicles with the raw materials they need to function optimally. If you have kidney disease or reduced kidney function, talk directly with your physician before increasing your dietary iron or protein intake. If you have a history of hemochromatosis, a condition where your body stores too much iron, do not follow this protocol without medical supervision. Excess iron can be dangerous. If you're taking iron supplements already, do not add more without consulting your doctor. Too much iron can cause toxicity, including liver damage. If symptoms of hair loss worsen, or if you notice other concerning symptoms like fatigue, shortness of breath, chest pain, or unexplained weight changes, do not assume diet is the only answer. Seek proper evaluation. This protocol is about optimizing nutrition to support hair health. It's not a substitute for diagnosing and treating underlying medical conditions. Final patient story. Gerald's transformation. Let me tell you about Gerald, 72. Gerald came to see me, not for hair loss, but for fatigue and weakness. He mentioned, almost as an aside, that his hair had been thinning for years. I figured it was just part of getting old, he said with a shrug. My father was bald by 65, but when we ran his blood work, his ferritin was 18. He wasn't anemic, but his iron stores were severely depleted. I explained the connection between low iron, fatigue, and hair loss. I had Gerald start eating 2 eggs every morning, paired with a small glass of orange juice. He also added a low-dose iron supplement under my supervision, since his ferritin was so low. We rechecked his ferritin after 3 months. It had climbed to 52. After 6 months, it was 68. Gerald's energy improved dramatically. He started walking again. He felt stronger, but what surprised him most was his hair. I wasn't even trying to fix my hair, he told me during a follow-up visit. I was just trying to feel less tired, but look at this. He pointed to his hairline. There was visible new growth, dark, thick hairs sprouting where his scalp had been thinning. My wife said I look 10 years younger, he said, smiling. I didn't believe this would work. I thought hair loss was just genetics, but I can't argue with what I see. Gerald's story is not unique. I've seen this pattern dozens of times. When you give your body the nutrients it needs, especially iron, protein, and the cofactors required for absorption, your hair follicles respond. Not overnight, not magically, but gradually, measurably, consistently. Your action plan. Here's what I want you to do starting tomorrow morning. 1. Eat 2 whole eggs for breakfast. Cook them however you like. Just make sure you eat the yolk. 2. Pair your eggs with a source of vitamin C, a small glass of orange juice, a handful of strawberries, a sliced bell pepper, or a squeeze of lemon juice over your eggs. 3. Add spinach or tomatoes if you want to boost the benefits. A simple veggie scramble is perfect. 4. Wait at least 30 minutes, ideally 1 hour, before drinking coffee or tea. Give your body time to absorb the iron without interference. 5. Track your progress. Take a photo of your scalp and hairline today. Take another photo every month. Compare them after 3 months. You'll be able to see the difference more clearly than you can by looking in the mirror every day. 6. Ask your doctor to check your ferritin level. Knowing your baseline helps you understand if this approach is enough or if you need additional iron supplementation. 7. Be patient and consistent. This isn't a quick fix. Give it at least 3 to 4 months before you judge the results. If after 4 months you observe real improvement, less shedding, new growth, thicker hair, keep going. Make this your permanent new normal. Your hair follicles aren't broken, they're just starving for the nutrients they need to function. Feed them consistently and they will respond before you go. If you made it all the way to the end of this video, please type "I watched till the end" in the comments below. It genuinely helps me understand that this message is reaching people who truly need it, and it helps YouTube share this vital information with more people struggling with hair loss. Now, I want to know, where in the world are you watching from right now? Drop your age and your country or city in the comments below. I read every comment and I love seeing how far this message travels. It reminds all of us that managing our health as we age is a universal challenge we're facing together. If this information was genuinely helpful to you, please give it a like. It tells YouTube to share this with more people who need it. And please share this with someone you care about, a parent, a spouse, a close friend who's struggling with hair loss. A simple click can start a conversation that could genuinely give them their confidence back. If you're not already subscribed, hit that subscribe button now. I share science-based health information every week specifically for adults over 50 who want practical, evidence-backed solutions for aging, nutrition, and vitality. Turn on notifications so you never miss future videos. Remember, hair loss after 60 is not always just genetics or inevitable aging. Often it's your body asking for specific nutrients, especially iron, that become harder to absorb as you age. Your hair follicles aren't failing, they're just not getting what they need. 2 eggs every morning paired with vitamin C, giving your body time to absorb the iron without interference. That's a simple, practical, science-backed strategy that can make a measurable difference. You now have information most people never receive. Use this knowledge to reclaim your hair health. The next time you see your doctor, go prepared. Show them the changes you made. Ask them to check your ferritin levels. Take care of yourself. Your body isn't broken. It just needs the right fuel. This is Dr. Robert Anderson. Feed your follicles, restore your hair, reclaim your confidence. I'll see you in the next video.